good, and you?
Really good. Thank you so much for joining us today. It's really exciting to have this opportunity to chat with you.
Oh, it's my pleasure.
Great. So we'll hop into the questions soon, but I do just want to take a moment to do a quick land acknowledgement. So I would like to acknowledge that I'm speaking from unceded Indigenous lands. The Ganyangahaga Mohawk Nation is recognized as the custodians of this land and waters that I'm speaking to you from. Montreal is historically known as a gathering place for many First Nations. Today, it is home to a diverse population of Indigenous and other peoples. We respect and continue to acknowledge this connection with the past, present, and future in our ongoing relationships with Indigenous and other peoples within the Montreal community. So I'd like to invite everyone to take a moment and just make your own acknowledgements. We'll give you a moment of quiet to do that. Okay, wonderful. So we can do the introductions now. I'm Casey Ferreter. I am the Advocacy Campaign Coordinator for Engineers Without Borders. And for the next 20 minutes, I'll be speaking with the Honourable Karina Gould, Canada's Minister of International Development. And we'll be speaking a little bit about Canada's place in the work that we're doing now on COVID. Minister, would you like to say a few words?
Yeah, absolutely. Well, Casey, thank you so much for having me today. And thanks to everyone who is participating and signing on and watching. I'm really glad to have this opportunity to engage with you and to hear from you. These are really extraordinary times that we're living in. And so I do want to begin by saying thank you to everyone who's playing your part, by isolating and physically distancing yourselves to make sure that we can stop the spread here at home. And I think that, we're starting to see, some good news here in Canada, which is positive. But, obviously we're still very concerned with what's going on around the world. And I think that, what we're hearing from a lot of experts is that, in the developing world, we're looking at maybe the peak in 4 to 6 weeks from now. And so what are we doing to prepare, and what are we doing in response? This is something that I don't think any of us would have imagined that we were going to live through a global pandemic. And so this, changes a little bit how we work, and it forces us to reflect on, how we do development and how we maybe need to do development a little bit differently, both in this context, but also coming out of the pandemic. So I'm really looking forward to answering your questions and hearing from you. And so I'll turn it back over to you, Casey. Thanks.
Great. Yeah, I'm excited about the conversation, and our community has been really excited about the conversation. So I'll just start with a few questions that came in from some of our community members getting ready for this chat. So our first question comes from one of our members, Lily from Guelph, asks this: COVID-19 has been extremely disruptive, both socially and economically worldwide, with many countries focused primarily on domestic issues. What does this mean for the direction that Canadian international aid is heading? And what role can Canada play in helping reverse this trend of worrying solely on the domestic response? So yeah, they're kind of focusing in as opposed to looking outwards as well.
Yeah, so thank you, Lily, for that question. It's a really, really good one. It's a really important one. So over the last 7 weeks, I've spent a lot of my time discussing with different heads of UN agencies and different heads of different international organizations and NGOs, as well as my counterparts in other donor countries, and really reinforcing the message that while we absolutely have to respond to COVID, and it needs to be a priority to make sure that we can continue to protect the health and safety of everyone right around the world, we also can't ignore our core development work and our core humanitarian work. And this is a message that has been really well received, particularly by the UN and NGOs, who recognize how important it is for us to stay the course, and a message that continues to be delivered. And actually, I co-hosted with Italy a high-level political forum on food security at the UN a couple of weeks ago, and that was one of the key points that we drove home, was that we can't forget or ignore the other really important development initiatives. And so for Canada's approach so far, We've been, to the best of our ability, trying to stay the course. Of course, some of the development activities that we would normally undertake are just not possible in a lockdown situation, but that doesn't mean that we're not still focused on our objectives. And one of the things that I think about a lot is, the situation for Ebola in the DRC. So I was in the Democratic Republic of Congo in mid-January and visiting, one of the Ebola hotspots. And what struck me is that while 2,000 people died of Ebola, at the same time, the DRC experienced a measles outbreak,
Hmm.
and twice as many children died of measles. And so we have to be super, super aware of what it means to pivot our projects away, particularly in health, from core service delivery. And so this is the key message that I've been delivering on behalf of Canada, but that we've so far been able to maintain in terms of what Canada is doing. And I would say that I'm also engaging with other development ministers, and a lot of us share this perspective. And so we're really trying to learn the lessons of the past to make sure that, we carry on with routine vaccinations, we carry on with, pre and antenatal supports, and important childhood health interventions, and then try to think creatively and differently about how we can deliver other development and humanitarian activities in the COVID context.
Wonderful. I mean, that's news that I'm sure so many of the membership of Engineers Without Borders is really happy to hear. It's never really been about solely Canada. It's always been us and others. So that's really great.
Mhm.
Thank you for that. So the next question comes from Humayun in Vancouver, and he asks, can Canadian aid continue to grow in a time like this, or will we still see it plateau and have to work within constrained limits? So going forward, is there a chance for growth?
Well, it's a really good question. And I mean, I don't really know the answer right now, because if you think about where we are on the domestic front, right?
Mm-hmm.
We've put close to $250 billion into our domestic response. The money that I announced back on April 5th was in addition to what we are already doing. But that being said, this is absolutely a time to think about that, but we probably do have to think about it within the constraints of our budget for the time being. But at the same time, as I've said many times, our domestic response has to include a global response. And so the Prime Minister's participation today in with the EU and other countries on the acceleration for COVID and technology is really important, because it's demonstrating that what we're doing here at home matters for what happens around the world, and what we do around the world matters for how we can protect ourselves at home. And so I was really encouraged, and I think you should be really encouraged by his leadership on this. And then we're also at the very beginning of this. It feels like we've been in it for a very long time, because it's been 7 weeks since we've, been in isolation here in Canada. But it's really only been about, well, January, 4 months, right, since the first case of pneumonia with unreported causes was reported in China. And so, we've seen how quickly it can spread around the world. But, whereas we are hopefully here in Canada getting to a place where we're flattening the curve, there's a
Mm-hmm.
lot of countries around the world that are just at the beginning of their outbreaks. And so we don't really know what the future holds, but we are trying to, just as we are with our domestic response here in Canada, reviewing, assessing, pivoting, and adapting as needed, moving forward.
Good. I mean, it's very encouraging. There's no reason to stop calling for more and better foreign aid. We should continue to
No.
call. Great. And then we have one more question coming from David in Fredericton. And he says, how can the Canadian public participate in making sure our global community comes out of this crisis a little stronger?
What an excellent question. And I think that part of this is about reinforcing why development assistance matters here in
Mm-hmm.
Canada. and reiterating to people that what we're doing abroad matters for our own health and safety here in Canada. And I think that what's really exciting is that the research and development activities that are taking place right now here at home. The Prime Minister said today we're going to make those available to the world. Right? That's part of our global solidarity. And when it comes to an invisible virus that doesn't know borders. It doesn't care if you're rich or you're poor, but it will have a disproportionate impact on the world's most vulnerable and the world's poorest. And the reason is because they don't have the same access to healthcare. They don't have the same access to diagnostics and testing that we have here in Canada. I mean, I
Mhm.
think about some countries in Africa where, they have fewer than a dozen ICU beds, right? They have fewer than a dozen ventilators. When we think about the mortality rate in industrialized countries, uh, that is partly because we have access to modern medical facilities where people can get treatment and they can have life-saving interventions. So it's so important for us to keep present and to be mindful of the fact that until everyone everywhere on the planet is safe, no one on the planet is safe, right? And so to keep sharing that message and to push back if people, say, well, why are we sending support elsewhere,
Mhm.
right? It's really important that we do, because otherwise, we're not going to be safe here in Canada. So anything that, Canadians right across the country can share and can explain why we're doing what we're doing, I think is so helpful and so important.
Yeah. There you go, everyone. You heard it from the minister. Start sharing that news. Spread that word.
Yes.
Um, Wonderful. So we had this question submitted ahead of time, but we do also have the audience watching and participating. We've hit the halfway mark with our conversation, so I do just want to switch gears and take some of the questions that have been coming in as we've been speaking.
Great.
So we have a few of those. I have somebody watching, so if we've missed some of the questions, I'm sorry. There are so many that came through. We simply couldn't get to them all. But let's see, one of the questions came in, when vaccines emerge, how do you assure fair distribution throughout the world?
Yeah, it's a really good question, and it's part of the announcement that we made today
Mhm.
with our EU partners, France, Germany, and Norway, was our commitment to make sure that the vaccines are going to be available, affordable, and accessible. And the Prime Minister said today that we will share the formula with everyone because we recognize that, again, we will not be safe here in Canada if everyone around the world isn't safe. And so we're working with the Gates Foundation, the WHO, and Gavi, so that we can both get the research and development, which is the primary pledging moment that was taking place today and over the coming month. But then also, once there is a vaccine or multiple vaccines available, that we can make sure that they can be scaled up quickly and that they can be delivered effectively.
Okay, wonderful. Let's see, we have a lot coming in. Another one coming in from David from Toronto, a locust problem that is putting more people into poverty and creating a rise in food security issues. How do we balance a response for COVID and food security issues arising from these locust swarms?
Yeah, great question. So just so you know, David, we have already contributed, I believe it's $1 million to the FAO and WFP response in East Africa. And so, as I said from the outset, what we're trying to do here in Canada and what my objective is to not ignore other really important humanitarian crises and to respond to COVID in addition to our existing responses in a humanitarian way. On food security, this is an issue that is top of mind for me. I had a conversation a couple of weeks ago with David Beasley, the head of the World Food Program, and his projections are quite terrifying when it comes to how many people could die of starvation if we don't get the food security question right. And obviously, what's going on in East Africa is of top concern. my understanding is the FAO response is quite well funded right now, but that doesn't mean that it's an easy response because we're talking about billions of locusts. But they are getting that activity underway, and they're also trying to do it in the COVID context, with physical distancing being a challenge as well. But one of the areas that I've been working on is, continuing to advocate for open access and continued trade when it comes to primary goods like food and medicine. And Canada has been very active within the WTO, within the G20 and the G7, promoting, the continued open access and continued open trade to really make sure that countries aren't taking isolationist measures or protectionist measures and are continuing to export those goods, which is really, really critical.
Yeah, yeah, it's hard to find a balance with all those things, but it sounds like there are a lot of people working around the clock
Mhm.
to stay on top of it. So I believe we have time for one more question coming from the audience. Is that okay?
Sure.
Okay, wonderful. So we have a question coming in from Zane. How does this outbreak change the view on international healthcare? Should it be a more globally focused rather than local issue?
It's a really good question. I think it's both. I had a conversation with Tedros, the Director General of the WHO, just 2 weeks ago, and one of the things that we were talking about was the fact that we need to have a global commitment to local delivery, right? And so I think it's both because, what we really have to recognize is that we need to make sure that there are primary healthcare systems in place everywhere around the world, and they have to be universally accessible. We have, spent a lot of time and money and resources investing in specific health interventions, right? So whether it's fighting AIDS or malaria or tuberculosis, polio, we've spent billions of dollars on those, and we've managed to make some really incredible, human development outcomes and life-saving developments in that regard. But where we haven't been so successful is creating those systems and creating the infrastructure to be able to manage and cope with epidemics or pandemics. And so even though a lot of, whether it's the Global Fund or Gavi or the GPEI, they've been able to pivot a lot of their systems to the COVID response, and that's been, wonderful and really helpful. I think we have to think more about what it means to build up local capacity. I think it gets to the first question that was asked, and I've been reflecting on this a lot. Here in the industrialized world or the global north, we're used to a global crisis happening and running to the front lines, right? And sending humanitarians and development workers to where the crisis is happening. But right now, in a global pandemic where there are outbreaks happening simultaneously everywhere in the world, that's just not feasibly or logistically possible to do that. And so that means that I'm hoping that what we take out of this crisis is a massive knowledge transfer in terms of how to respond to the local level, because that's where the front line is always going to be. And that's hopefully the lesson that we learn out of this, is because if in the donor countries we're facing the crisis, it's really almost impossible for us to send our resources there, and at the time where we were also asking people to come home. So it's a really good question, one I don't think we fully wrapped our head around, but I also think that we have to get the balance right, in making sure that we don't shift everything to pandemic preparedness, and ignore other really important life-saving health interventions.
Yeah, I mean, it speaks to some of the other questions that came up about
Mhm.
finding the balance between addressing this issue and neglecting the other things that are currently going
Yeah.
on. A lot of questions coming up. I regret that we can't get to them all. I do want to ask you, just on behalf of our membership at Engineers Without Borders. Um, Currently, there's a campaign, the Canada Cares campaign, that is meant to put pressure on MPs and Parliament to demonstrate that Canadians, the public here, want to see more and better aid going abroad. We've done well so far. The response has been pretty monumental, but we always think that we can keep growing. So with campaigns like that, is that the kind of thing that would be helpful for you to bring to Parliament and say, look, the Canadian public wants to see this kind of work being done, and keep going forward with it?
Yeah, I think so. I think that's really good. I mean, I think what we need to keep seeing and hearing from Canadians is that this matters to them, right? And that people care, not just about what happens here in Canada, but around the entire world. And so I continue to encourage you to do that, to reach out to your friends and your neighbors, explain, why development matters and why we do development and what it is, right? I think is really important because I think sometimes people have an idea that isn't necessarily true about what we do in development. And so anything you can do to continue to engage the public and to demonstrate why this is so important, I think is very, very helpful.
Wonderful. Okay, well, thank you so much. We have hit our 20-minute mark, but I do leave the floor to you for any last comments before we wrap it up.
Okay, well, Casey, thank you so much for the opportunity. I'm really glad we got to do this. I'm sorry that I couldn't get to all of the questions, but if you're able to collect them, send them to my office and we'll do our best to respond. And so you can share those with your membership. And just thanks so much to all of you for, taking a few minutes out of your day to participate and for being such strong advocates for the world's most poor and vulnerable. And so I really appreciate your commitment and your dedication. And I'll look forward to connecting with you again soon. So stay safe and take care of yourselves as well during this time. I know it's hard. And thanks again.
Yeah, thank you so much, Minister Gould, for joining us. Really appreciate it on behalf of myself and the membership. So thanks again and stay safe.
Okay, thanks. Bye.
Well, bye, everybody.